Hi everyone, my name is Diana Kiowa and I'm going to be presenting the strategic planning and policies. And I will also be touching on the 3 to 5 year strategic plan for security as well. And this is going to be very essential, especially when we're discussing the Valleyside AZ Medical Center, especially with its mission here, which is to provide healthcare while ensuring that the information is safeguarded from damages, manipulation, or harm to others in a digital sense. So let's get into it. Alrighty, so starting off here, we have the professional discourse into technical communication. And of course here, there must be a certain communication being established in InfoSec so that when problems do arise, there is an effective method of communication being delivered. So that means that there must be a few standards that we must keep in mind. And the first one here being is that there is a need to understand the audience. So according to Reese, he mentions effective communication in InfoSec is recognizing that different audiences require different approaches. So this is crucial since what he's saying is that each level department that I would be speaking to would need a different message conveyed to them. So there are a couple of different groups like the stakeholders, the board of directors, IT staff, clinicians, and so on. So for instance, when we talk about the IT staff, they need more details on what they are being tasked to do. As for people like the board of directors, they need more overall information. So that could be the ROI insights and what the cybersecurity risks there are. The next one is there is the writing process, and that has the goal of being straightforward while creating this easy to understand, basically making it user friendly. This can be done through clear and concise language, avoiding unnecessary jargon, and providing explanations, according to Adams 2025. Lastly, there are the design elements, and these are graphics that bring powerful visuals to show the organization's improvement. So these could be very informative charts, diagrams, frameworks, and so on. So in this slide and also in the next few slides, I will be taking you along a 3 to 5 year information security strategic plan. And the goal here is basically to have a secure plan where the systems are made in a protected way while expanding on its strengths. And it will also aim to have security over a long period of time. So here I'm going to begin with years 1 to 2. And this is where we're going to focus on building on daily operations while having in place immediate security measures. So the way to accomplish this is by first having the digital safeguards in place to secure the systems from the intruders. So this could be from the multi-factor authentication that you place in, firewalls that are implemented, just so that there's a defense put up for these systems. Next, there's also the need for monitoring, which helps identify any possible threats earlier on so that there is a quicker response to any of the issues that may arise. So you could use tools such as the SIEM, the threat intelligence, endpoint protection, or even vulnerability scans, and they are usually needed to achieve this. So with all of this, it is really great to have these tools, these digital safeguards, having that monitoring in place. But something that some organizations might kind of forget about is the importance of employees and the training of their staff. So it can be beneficial to also invest in the staff, and this can include trainings for the employees so that there isn't much room for human error, since this could also have a very large negative impact to the organization as a whole. So it is really important to just have that foundational, strong, knowledgeable team for your organization. And this is what we would be focusing on for these years as well. And then lastly, there is the compliance factor to consider. And for example, the healthcare sector that we will be considering, it is important to be following their standards and rules such as the HIPAA, False Claims Act, and any other healthcare provision that we should keep in mind. Now in years 3 to 4, the strategy moves into enhancement while making it more robust. So we kind of just touched on all of the things like the safeguards, monitoring, kind of building that foundation. But here, the thing to keep in mind is to have things implemented and put in place in case there is a shutdown. So when it comes to healthcare especially, it can be especially crucial to not be shut down for too long because the care and the attention that is needed for the patients. So it is important for Valleyside AZ Medical Center, for instance, to have a well-structured disaster recovery plan and to also have cloud storage backups for any potential loss or damaged data. So it can be a good idea, according to PMR 2024, that the zero trust architecture is established so that there is a minimized risk of data breaches. And he also mentions that this also ensures that only authenticated and authorized entities can access sensitive healthcare data. So there should be something such as the RBAC as well to further prevent access without permission. So RBAC is role-based access control. Things like this being implemented in is very important so that it is where everyone knows where they're supposed to be working in. So it is best to not have everyone just being able to access everything, just to ensure that safety for the information itself. Lastly, there is the need to have a secure environment for all the medical equipment or the IoT devices, such as the imaging devices, medical monitors, and so on. Those are also important to keep in mind to be protected. And there needs to be an expansion on previously mentioned network defenses. So these protected the system from the intruders, but to build on that security, the data also must be protected too through strong encryption. So that's something that's really important to kind of just implement and integrate into the plan as well here. So now we're in year 5, and this will be about having the strategic plan become something that can be achieved long term and building on it so that there can be growth. So the other ones were just kind of building a foundation, kind of just enhancing, and now we need to focus on how are we going to maintain this plan? How are we going to make sure it's long term, it's effective, and successful? So for instance, this can entail to make sure that there is a predictive risk modeling developed so that there is a minimized risk exposure, since it can be helpful to distinguish what risks are ahead and to stop them before they cause damage, especially according to Threat NG 2025. So it's also important to have a budget control to keep up with the plan. So sometimes we can get ahead of ourselves and wanting to put all of these amazing safeguards, these digital safeguards, and all of the things to protect that data. But it is important to keep in mind a budget and to know what exactly an organization can be handling cost-wise. So this can be done by utilizing tools that are only necessary for the organization's security and to keep the strategic plan running. So we want to have the best types of devices and tools to protect the data and information, but also something that's very cost-effective, but still giving that a quality when it comes to protection. So then there's also the duty of the organization to make sure to re-examine and make sure that the resiliency programs within the organization is structured enough to be efficient in the next years looking forward as well, according to EY. So lastly, we must keep in mind that the advances being made in the future of cybersecurity and to keep up with them. So cybersecurity is evolving constantly. So the way we can do this is through the AI-driven threat detection within cybersecurity as well, and kind of just having that integrated into this plan as well, coming and looking forward. Now I'm going to continue off from the previous mentioned plan by mentioning the security architecture solutions here. This approach has a multi-layered defense strategy in place, and that's just to keep up with the ever-changing role of cybersecurity and of course the emerging threats that come with it over time. And so I'm just going to go through by each layer. And the first one is going to focus on the employees and if they know how to go about their roles within the organization. So according to Cohesity, focus on the policies, procedures, and security awareness training about storing and accessing data. This can be done through having role-based access controls, single sign-on, and multi-factor authentication. And this first layer is just basically to set a strong foundation by having a knowledgeable team, which is really important. Secondly, there's a physical layer. Since it is going to be really crucial to make sure that people aren't able to have actual physical access before we start thinking about the digital safety. So this is done through simply, it could be with guards, key card access points, and so on. The third layer here is when there is a focus on what is coming in and how to strengthen this. So this could be basically the main components, which are the intrusion detection system, firewall, and security controls that will be aiding the monitoring of incoming and outgoing network traffic according to CIO Tech 2025. And then the fourth layer here is to focus on the extensibility by implementing the SIEM, which is basically standing for the Security Information and Event Management System, according to Cohesity. So what this will provide is the analytics for the previous mentioned monitoring. So it is still important, and according to Cohesity, it's still important for the organization to further protect their data. So catching those emerging threats or suspicious behavior earlier on basically allows for a quicker response solution, which we would want for this. And then the fifth layer is highlighting, according to Cohesity, is the internal network security. So this is where additional protection comes into play, which is encryption that is needed for data in transit, outbound web filtering, 4 eyes, root level system changes, microsegmentation, and more, according to Cohesity. And then lastly, there has to be some sort of a backup put in place, which is where a secure cloud and backup services comes into play as well. So if there is to be a natural disaster, for instance, or a damaging attack like ransomware and so on, there would need to be that ability to recover the operations and not have the organization's services just to be put at a hold because of it. So having something like this in place kind of allows the organization to not be afraid that they're going to lose all their data and everything and not be able to resume their operations just because something like this were to occur. So during the plan's implementation, it is also important to note the key organizational roles that are going to be involved, and one of which is going to be the Chief Information Security Officer. And this is someone who is in charge of looking after the overall strategy with having those profound skills in knowing the compliance requirements and being able to handle the risk management as well, according to Peticho 2025. There is also a need for a security manager, and this person knows how to manage a security team on a day-to-day basis. This would include basically overseeing access control, vulnerability management, and incident response for the organization, according to Peticho 2025. Next, there's going to be the IT security team, and these people are just really well trained in handling the training of employees, monitoring the systems, the implementation process, utilizing patches, being able to keep up with the updates, and so on. So this is a very, very robust team. It has to be pretty much knowing how to do a lot of the stuff and the processes to keep it running. And next we have the security analyst, and that is where there needs to be someone who is analyzing the incident, risks, the vulnerabilities, so to prevent any breaches from happening. And then we also have the incident responder, and this is someone who's particularly specialized in bringing systems back to normal in case of data breaches, ransomware attacks, and so on, or even natural disasters that we had previously mentioned. And then lastly, we have the security engineer, and that is someone who's going to be able to build and implement and design that security infrastructure as well. So next I'm going to be talking about the components of IT governance and cybersecurity frameworks. So starting off, I'm just going to note the two. IT governance is the processes or rules that help the organization kind of support its objectives while being in compliance of the standards. And then frameworks are kind of just acting more as the guiding roadmap to protect the system. So starting off, the NIST framework is one great one to mention because it is basically when you're aiming to uphold regulatory obligations. And then another robust framework is the ISO 27001. And according to Willard 2025, it is perfect, especially for organizations aiming to enhance security, build trust, and meet regulatory requirements. So with IT governance, it's making sure to strengthen the transparency aspect, accountability, and decision-making process, which provides an organization long-term success, according to RDoC 2024. With now the Valley Side AZ Medical Center in mind, there also needs to be an integration of healthcare regulations, such as the HIPAA as well. So next I'm going to be noting the computing problems solved through effective communication. So it is really important to have effective communication when it comes to having computing problems resolved. And it is about having awareness of what each sector or audience needs to hear to get their job done successfully, and that requires good communication. So for instance, the board and executives are mainly waiting to hear the why aspect of why something will be impacting the business positively or negatively. This means that they want to be presented with the risks associated with the organization, maybe the downtime that's expected from a risk, the costs, the losses financially, and so on. They don't exactly want the nitty-gritty specifics of everything else, but instead information like I had mentioned to help them make the best decisions for the company or the organization overall when they're moving forward. For IT teams, they're going to need more specifics because they want to make sure they know how to, basically what they need to do in a proficient manner. They're more focused on how to do it. And they are needed to patch vulnerabilities, they're there to address ransomware attacks, and so on. So they are focused on restoring the system in case of an attack and so forth. So they would need more specific details. And then lastly, we have a non-specialist staff, and they're not as technical, and they must be communicated at with more generic directions. So this helps them to know what to do on their daily duties when it comes to safeguarding the organization's security. So here it's really important to talk about how now the InfoSec plan is aligning with the organizational mission and vision with Valley Side AZ Medical Center. So starting off, the Valley Side AZ Medical Center is there to provide healthcare, and because it handles so much sensitive data, it becomes really imperative to oversee all areas when it comes to running it. So its main vision and mission, just to reiterate it once again, is to provide care to patients in a reliable and consistent manner. And it's also aiming to respond to everything as quickly as possible, just to ensure and maintain a trustable reputation. So the InfoSec plan supports exactly that through all these different ways that the InfoSec plan was highlighting. So basically, first off, there is the preventive measures in place to safeguard data. So that could be data such as the patient's data or the hospital's information that they have as well through their research. These are all important things to be safeguarded, and the InfoSec plan is there kind of implementing digital safeguards and all these different things to ensure that safety and protection. And then there's also the all-around effective communication. So especially in a hospital, there are so many different departments that it's really important to have effective communication on what's going on, who's doing what, and all the job roles. So having all of that is really important with communication, because you need to know what is going on, especially when it's such a chaotic kind of environment. And then the next one, we have a recovery plan to reduce or prevent downtime. So one of the main things that you don't want, especially in a hospital, is to have too much downtime, because there are so many patients who are relying on your care. And it's really important to make sure that everyone is knowing what to do, having those cloud or backup services in place, all of these things to ensure that it will not have too much downtime. So the next one, of course, is keeping up to date of everything. The InfoSec plan does make sure to always stay up to date on everything that is happening, and to also have the tools and systems as well to be up to date. And then there's also the innovative and modern systems to maintain consistency. And there's also the the emphasis on aligning with organizational goals, even with the budget and the being able to align with everything when it comes to the organization itself. The InfoSec plan really emphasizes this. And then the next one is the compliance. So having those standards and regulatory standards, basically ensuring those. So HIPAA and all the different ones we mentioned, it's also there so that the hospital is being run in the correct manner, basically. So here's just basically a little bit of a run through on the differences between the policies, standards, and guidelines and procedures. Policies are just basically the set of rules that are laying out the intentions of the organization's security program, according to Spoden, 2017. And the standards, they're just there, they're required and provides the policy support. So with the guidelines, now it's providing a helpful approach on what best practices to use to enhance that flexibility. And then the procedures is just more of a detailed outline, basically laying out the specific processes on how to carry out those tasks. So as I'm wrapping up here, it is important to recognize how much goes into the strategic planning process here, and especially with aligning a 3 to 5 year InfoSec plan with a valley-sized AZ Medical Center's mission and vision. It's very transferable to any different organization as well. So just keep that in mind, how important it is to have these little different components such as effective communication, employee training, whether it's digital safeguards, implementing these different things, the different layers are important for the overall success of an organization. And it is, of course, still important for us as cybersecurity professionals to be having that responsibility and showing that leadership to support this and being able to do our part to have the expertise to be able to carry out these plans so that we are able to bring our community trust and being able to trust us with that data as well, that we will ensure to protect it. So thank you for listening, and that would conclude my presentation.